Use of Cabergoline tablet. Cabergoline is a medication that is primarily used to treat medical conditions related to the regulation of prolactin, a hormone produced by the pituitary gland. Here are some common uses of Cabergoline tablets. Hyperprolactinemia. Cabergoline is commonly prescribed for the treatment of hyperprolactinemia, a condition characterized by elevated levels of prolactin in the blood. This condition can cause symptoms such as irregular menstrual periods, infertility, breast milk production in non-lactating individuals, and reduced libido. Cabergoline works by reducing the production and release of prolactin, thereby alleviating these symptoms. Prolactinomas. Prolactinomas are benign tumors of the pituitary gland that produce excess prolactin. Cabergoline is often prescribed as a long-term treatment to shrink these tumors and normalize prolactin levels. It helps reduce the size of the tumor and improves associated symptoms like headache and visual disturbances. Parkinson's disease. Cabergoline is also used as an adjunctive therapy in the management of Parkinson's disease. It acts as a dopamine agonist, stimulating dopamine receptors in the brain and helping to alleviate the motor symptoms of Parkinson's disease, such as tremors, stiffness, and impaired movement. Dosage of Cabergoline tablet. The dosage of Cabergoline tablet can vary depending on the specific medical condition being treated. The following are general guidelines for the use of Cabergoline. Hyperprolactinemia. The recommended starting dose for hyperprolactinemia is typically 0.25 mg to 0.5 mg taken orally once or twice a week. The dose can be gradually increased as needed, usually up to a maximum of 1 mg per week, based on the individual's response and prolactin levels. Prolactinomas. The initial recommended dosage for prolactinomas is usually 0.5 mg per week, taken in 1 or 2 divided doses. The dose can be adjusted as necessary to achieve the desired reduction in prolactin levels and tumor size, typically ranging from 1 to 2 mg per week. Parkinson's disease. The recommended starting dose for Parkinson's disease is often 0.5 mg taken orally twice a week. The dosage can be increased gradually, usually up to a maximum of 3 mg per day, divided into multiple doses, based on the individual's response and tolerability. It is important to note that these dosages are general guidelines, and your healthcare provider may prescribe a different dose based on your specific condition and individual factors. Mechanism of action of Cabergoline tablet. Cabergoline is a dopamine agonist, which means it works by stimulating dopamine receptors in the brain. Its primary mechanism of action is as follows. Prolactin inhibition. Cabergoline acts on the dopamine D2 receptors located in the lactotroph cells of the pituitary gland. By stimulating these receptors, it inhibits the release of prolactin, a hormone that is responsible for milk production in breastfeeding women and plays a role in regulating the reproductive system. By reducing prolactin levels, Cabergoline helps normalize menstrual cycles, reduce breast milk production in non-lactating individuals, and restore fertility in cases of hyperprolactinemia. Dopamine replacement. In Parkinson's disease, there is a loss of dopamine-producing cells in certain areas of the brain. Cabergoline acts as a dopamine agonist, directly stimulating dopamine receptors in the brain, particularly the D2 receptors. By mimicking the effects of dopamine, Cabergoline helps alleviate the motor symptoms of Parkinson's disease, such as tremors, rigidity, and bradykinesia, slowness of movement. It helps restore the balance of dopamine in the brain and improve motor function. The precise mechanisms through which Cabergoline exerts its effects are complex and not fully understood. It is believed that Cabergoline's binding to dopamine receptors leads to the activation of intracellular signaling pathways, resulting in the desired therapeutic effects. Side effects of Cabergoline tablet. While Cabergoline is generally well tolerated, it may cause some side effects. Not everyone experiences these side effects, and their severity can vary from person to person. Common side effects of Cabergoline tablet include nausea and vomiting, dizziness, lightheadedness, headache, fatigue and drowsiness, gastrointestinal disturbances, changes in blood pressure, mental or mood changes, valvular heart disease. Important advices for using Cabergoline tablet. When using Cabergoline tablets, it is important to follow these important pieces of advice. Medical supervision. Cabergoline should only be used under the guidance and supervision of a healthcare professional. They will determine the appropriate dosage, frequency, and duration of treatment based on your specific condition and individual factors. Regular follow-up visits are essential to monitor your response to the medication and adjust the dosage if necessary. Compliance with instructions. Take Cabergoline exactly as prescribed by your healthcare provider. Follow the recommended dosage, timing, and frequency of administration. Food intake. Taking Cabergoline with food or at bedtime may help reduce the incidence of nausea and vomiting. Position changes. Cabergoline may cause dizziness or lightheadedness, especially when standing up or changing positions. To minimize the risk of falls, get up slowly from a sitting or lying position. Alertness and activities. Cabergoline can cause fatigue and drowsiness. Avoid engaging in activities that require mental alertness, such as driving or operating heavy machinery, until you know how the medication affects you. Regular monitoring. Your healthcare provider may conduct regular blood tests and other assessments to monitor your response to Cabergoline and check for any potential side effects. Mental well-being. Be aware of any changes in your mood, including symptoms of depression, anxiety, or other mental health issues. Inform your healthcare provider if you experience any significant changes in your mental well-being while taking Cabergoline. Other medications and medical conditions. Inform your healthcare provider about all the medications you are currently taking, including prescription, over-the-counter, and herbal supplements. It is important to disclose your complete medical history to your healthcare provider. Pregnancy and breastfeeding. If you are pregnant, planning to become pregnant, or breastfeeding, discuss the risks and benefits of Cabergoline with your healthcare provider. Cabergoline is generally not recommended during pregnancy and lactation, except in specific circumstances and under medical supervision. Storage. Store Cabergoline tablets in a cool, dry place, away from direct sunlight and moisture. Follow the specific storage instructions provided by the manufacturer or pharmacist.